Hello, friends. This is Dr. Anil Ganjoo, a consultant dermatologist practicing out of New Delhi. Today, we are going to talk about a very important condition that we see in our practice on a day-to-day basis, and that's associated with a huge psychological stress amongst the patients. Vitiligo, a cosmetic disorder, basically has a huge psychosocial impact on the patients who are affected. There are a lot of myths and misconceptions associated with this disease. Due to the stigma and misinformation of this disease, the patients and the families are under immense psychological stress. So it becomes very important for us dermatologists and for the society at large to understand the benign nature of this disease and consider that these patients are suffering from this condition and have a lot of psychological problem. They need to be looked at more sympathetically. So let's today bust the myths associated with this disease called vitiligo. Friends, vitiligo is an autoimmune disorder which is associated with damage and destruction to the color-forming cells within the skin. These are called melanocytes, and this happens because of an autoimmune process where the immunity is working against these cells called melanocytes. And in the skin, it presents as white patches with loss of color. That can happen on any part of the body, but one has to understand that it is just a cosmetic defect. It is also important to understand that it is not contagious. So many of the patients, many of the people in the society believe that this is a contagious disease. So a patient suffering from this disease should not be touched, should not be made contact with. This does not spread to anybody by any kind of physical contact or touch or hugging, kissing, etc. The disease can be treated and controlled effectively with the present day modern dermatological care available. It, however, has a tendency to recur because the basic tendency to have this disease does not go. So what do we do when you have this disease? Do not panic in the first place. So this is not something that cannot be taken care of. It is a very well controlled disease with proper medical treatment. So see a proper dermatologist. Do not fall into the trap of quacks. So there are many people around because they take advantage of the psychological problem associated with this disease. People keep on running helter-skelter looking for people to help them. So quacks are around. So do not fall into their trap. They'll assure you that they're going to give you complete cure, but it does not happen. Be confident that you just have a cosmetic defect and do not be bogged down by people telling you that you have something grave happening in your body. So the course of disease is benign. Most of the patients have a localized disease and that can be treated, but some people have a progressive disease spreading to many of the body parts. But we with medical therapy can control the spread of the disease, treat the disease, and then with phototherapy, which is ultraviolet light therapy or the sunlight, we can bring back the color in these patches of skin which have lost their color. And in case there are leftover patches which do not respond to phototherapy, which do not respond to medical therapy, we also have surgical treatment available now, and we can take care of all kinds of vitiligo patches that are left behind. Therefore, we need to understand that vitiligo is just a cosmetic defect. It is not associated with any other kind of problem within the patient's body. There's no physical problem. There's no other organ involved other than the skin. The disease is not communicable at all. That is very important for the people and patients to understand. It does not spread to others. And this disease is completely controllable, completely treatable with the modern medication, phototherapy, and in some cases, surgical procedures. So there's a need to look at these patients sympathetically, show compassion towards these patients so that we take them out of the problem that they are associated with having this disease, because this disease not only has a physical problem, but it has a psychological component to it also. So friends, look at these patients passionately and compassionately and understand that this is a completely treatable, non-communicable disease. Thank you very much.